Ultrasound site provides regular training courses for ultrasound guided injections, making use of cadaveric specimens. This short presentation is going to be looking at the use of cadaveric specimens and how this can be used to really improve people's training. So we're going to look very quickly at what is the evidence for training on cadavers in a lab, what are the potential benefits, and what are the main considerations and differences on using and training on cadaveric specimens versus human specimens. So if we look at the evidence for using cadavers for training of ultrasound guided injection procedures, we would look predominantly at Hockin et al. 2011, where they ran a 2-day course, 50 participants, and 98% found that the cadavers were beneficial to their education, and a vast majority of the delegates on these courses reported that they felt very much more confident performing ultrasound guided injecting procedures, and that they continued to feel increased confidence some 3 months later on. Specifically, this training course was looking at anaesthetics and nerve blocks, but there's obviously a very significant overlap in terms of the theory and the motor skills that are required to perform in musculoskeletal guided procedures. Cadavers offer more realistic imaging and tactile needle feedback, so the proprioception that we get from the needles and the architecture for the injections is obviously very, very similar. The cadavers provide image quality, and in particular the landscape and the challenges of performing specific injections into specific joints and soft tissue structures can obviously be very well mimicked on the cadaver. The needle visibility is actually more difficult in the cadaver, and for this reason it actually provides a significant challenge, additional challenge on needle visualization. It's actually deemed to be more difficult to needle vis than other phantoms such as meat specimens and synthetic gel models. Data collected by Goff et al. In 2012 showed again delegates showing significant improvement in their technical skills and confidence following a 2-day cadaveric course, and this was the British Society of Rheumatology. So the main issues in a novice when they're performing ultrasound guided injections, one of the main issues can be the failure to adequately visualize the needle before advancing. So performing ultrasound guided injections on a cadaver or any phantom for that matter, one of the key skills that you can develop is that ability to visualize the needle and the needle tip as it enters into the tissue, and then to be able to track that needle tip to the target structure. And obviously performing this on the cadavers means that we can develop these skills quite significantly before taking this into clinical practice and practicing on our patients. One of the other issues that has been identified in novice injectors, ultrasound guided injectors, is failure to advance the needle quickly enough. So not identifying the needle tip, but also the failure to advance the needle tip quickly enough towards the target structure. So practicing on a cadaver and practicing on phantoms can be a really good way of developing this technical and skill, and developing the hand-eye coordination and the technical skill of needle visualization and advancement of the needle, which significantly improves the confidence of the student. Numerous studies have looked at ways of developing ultrasound guided injections and in a way to develop these motor skills and develop these skills before taking them into clinical practice. Developing skills over a longer period of time on our clinical patients means that there's more likely to have potential clinical incidents, cause pain to our patients, and therefore this practicing on cadavers and other phantoms and other specimens means that we fast track those technical skills and therefore minimize the number of injections performed on our patients in a suboptimal fashion. So in other words, we do our practice on the cadavers and the phantoms, and we get really good at all the technical aspects of performing an ultrasound guided injection before we actually take this into the clinical practice environment. So the main benefits are being able to practice in a stress-free environment. So in other words, you don't have a patient there as an added pressure or distraction, and you're not worrying so much about the patient's comfort and or possible litigation that may come if the injection is not performed well. Cadaveric injection practice means that you can practice under close supervision with feedback and opportunity to immediately employ the changes and adaptations in the technique that have been suggested to you by your tutor. So in other words, you can practice over and over again there and then until you get it right, rather than having to wait until the next patient comes in with that particular condition. There's an opportunity to acquire in-depth knowledge of the relevant regional anatomy and really get to know some of the particular region-specific challenges around needle visualization, getting to know your angles and where the needle is going to come onto the screen. Again, all of this sort of real technical skill can be really refined in the lab on the cadavers by having multiple repeated attempts at each of the different injection techniques, so that you really fast track those motor skills. The training also allows to bridge the gap between obtaining appropriate sonographic image and actually performing the injection. So in other words, we get used to this idea of needle viz, taking it to the structure and performing the injection, and provides a unique opportunity to simultaneously develop motor skills required by repeated practice there and then, with direct feedback and a chance to correct. This is a pictorial demonstration of the differences between needle visualization in a cadaver versus some of the other potential phantoms and meat specimens. You can see from this pictorial that the cadaver actually provides one of the more difficult training environments. There are obviously differences when scanning a cadaver versus a live subject. In particular, obviously, we won't get any Doppler signal, so we don't have the opportunity to practice avoiding vessels in quite the same way. And so that is one of the shortfalls of cadaveric practice. Also, you'll find that the fascial planes dividing the different tissues can be less clear on cadavers, and particularly sometimes in the periphery. The feet and the hands can be quite dehydrated, so they can be more challenging on cadavers and sometimes don't provide quite such good opportunity to practice. The depth of the structure. So here on the left-hand side of the screen, we're looking at the medial joint line of the knee, and we can see here that there's significant dehydration of the tissue, such that the bony architecture is much more superficial on the image than would normally be the case. The image on the right side of the screen is looking at posterior shoulder glenna humeral joint, and again, this is much more superficial than we would normally expect to see. As mentioned a moment ago, some of the soft tissue structures can be less obvious So here we're looking at an Achilles tendon on a live human subject, and on the right hand side an Achilles tendon on a cadaver. I would say that that is a particularly challenging specimen, which obviously being used here to demonstrate, quite how challenging it can be sometimes on a cadaver. But obviously we will look to try to select the best cadaveric examples that we can use on the courses, and we oftentimes move people around the room so they get an opportunity to practice on different cadaveric specimens, so that they get to use ones that are less challenging. This initial video is showing ultrasound guided injection into the medial knee on a cadaveric specimen. You see here how superficial the structures are versus doing on a live human subject. And it does change the angle, and it does mean the actual angle of the procedure, in this case, is slightly more shallow, which may actually aid needle visualization, obviously, in the case of a medial knee. But it just gives you an example of how appearances can be different, and therefore slightly change the angles that you are required. But again, the tutors on the course will signpost this to you and make sure that you are clear about how this will differ from a live human subject. So, as mentioned, there can be a large variation between different cadaveric specimens, as there can be on human subjects. So we always encourage people to move around the room and to practice on different specimens. One of the other challenges of cadaveric specimens is that they can be quite difficult to maneuver and position. And again, the tutors on the course will signpost, the cadavers will be positioned as best they can, but there will be compromise for some procedures in terms of the positioning of the patient compared with in clinical practice. So in conclusion, cadaveric specimens are an excellent resource when training for ultrasound guided injections. There is evidence that a 2-day training course for ultrasound guided injections can significantly improve skills and confidence levels. There are a number of differences to be aware of, and many of which can make the cadavers, if anything, more technically challenging. But as we point out on our courses, this is all the more reason why when you get back into clinical practice, you'll feel very, very confident. And just to finish off, here's some reference slides from this lecture. Thank you very much for listening.